Okay, thank you all for being here. My name is Sharice Iglesias. I'm the Training and Resource Director here at Community Campus Partnerships for Health, CCPH. And thank you all for coming to our very last Lunch and Learn workshop on qualitative research. So I'm just going to launch a very short poll here just to get a gauge on who's here and who's familiar with the topic. But the poll time question is, how familiar are you with community engaged qualitative research? And I'm just gonna launch the poll here. Okay, so the question should appear in front of you. How familiar are you with community engaged qualitative research? Okay, we got 56% participating, 76, 78. Very good. So everyone's about somewhat familiar. Most people, few people very familiar. Okay, take the next 5 seconds to complete that poll. Okay, so mostly somewhat familiar. Good to know. We have a panel, and my colleague Kunga is going to introduce some concepts to make this more digestible, and so we can learn together. Let's see. Sharing the results. Okay, very good. Thank you for participating in that. Okay, for those who don't know, Community Campus Partnerships for Health, CCPH, is a small nonprofit that promotes health equity and social justice through partnerships between communities and academic institutions. And our work is led by these strategic pillars. So where we lead equitable and authentic community academic partnerships, we disseminate information and resources, and we conduct training such as these. And just to highlight one of our long-standing partnerships, Clinical Scholars, funded by the Robert Wood Johnson Foundation out of UNC Chapel Hill. For those who don't know, the Clinical Scholars is a fantastic group of clinicians that conduct research in their communities to address health inequities. And as a long-standing partner with them, we share technical expertise and we provide thought leadership to sustain the partnership. And this is a question for you all, just to get, more of a gauge on who's here. In the chat, please insert your name and pronouns as well as your organization and affiliation. Just say hello, just get to know who's here. And as you're putting in that information, I'm going to move on with the workshop. So our learning outcomes for today are threefold. The first is to understand how community can strengthen qualitative methodology. Number 2 is create structures to support and sustain community engagement in research. And the third one is to center community experiences to determine qualitative methodology. And those are our learning outcomes for today. And now I'm going to pass it on to my colleague, Dr. Kunga Denzongpa, who will lead us in our discussion of qualitative research.
Thanks, Sharice. Good afternoon, everyone. My name is Kunga. I am the Data and Evaluation Manager here at CCPH. And so in the next 10 minutes, I'll quickly give you a basic overview of qualitative methodology. Our panelists will go more into detail in terms of what community engaged qualitative research looks like. So I'll just introduce some very basic terms with you all, which some of it might be knowledge that you already know, but some of it might be new. So we'll see. All right, so we'll start with some key terms. I'll firstly would like to discuss the term epistemology. For those who don't know, epistemology is basically this philosophy which studies knowledge, right? So it seeks to understand what we know and how we know. And so it's really important as researchers to understand our epistemological approach to the research, because it helps us think about and be intentional about the ways in which we're engaging in research. And so then after that, there's methodology and methods. I wanted to discuss this very briefly because sometimes there's a misconception of using these terms to be interchangeable. But methodology is really the theoretical underpinning, right? And so it's a general approach to studying research topics. So methodology can either be qualitative or quantitative. And researchers also involved in our understanding of methodology. Methods in specific are very specific research techniques that help us approach either a qualitative or a quantitative methodology. So for example, for a qualitative methodology, the methods that we would potentially approach are grounded theory or ethnography or phenomenology or narrative case studies and as such, right? And so these are just terms that I wanted to introduce. And community engaged qualitative research, of course, will be talked a little bit more deeper by our panelists. And so I want to start with what really qualitative methodology. As we talked about, methodology simply refers to the choices we make about the topic of interest, right? And so with qualitative methodology, we utilize it to make sense of how we see the world. And so it's usually exploratory in nature, meaning that we don't go into the community or we don't engage in the research topic without any assumptions. Unlike a quantitative method, we don't have a theory or a hypothesis that we want to test and prove, right? It's very exploratory. We go very with an open mind into the topic of interest or the community. It's also inductive, which means that we usually start with a set of observations, and they're usually a smaller sample size. We then identify certain patterns within those set of observations, and then we make meaning out of that data and try to stay as true to the data as possible, because much of qualitative methodology is making interpretations of the data. So the intention is to stay as true to the data as possible. One of the most important aspects of qualitative methodology, I think, is that the approach and the findings that we pursue in qualitative research is transferable, but they're not generalizable. What do I mean by that? So transferable in terms of the approach that we conduct or the findings that we get from the research can be transferred to study a similar topic or a similar community, but we cannot generalize that if we replicate the same set of approach or the same set of finding or same set of research, we will get the exact same results. So they're not replicable, so they can't be generalizable. So qualitative methodology is usually always the findings are usually always transferable. And something very basic, but I thought I should bring up, is just because someone did, semi-structured interviews or hosted focus groups doesn't mean that they adopted qualitative methods, right? Interviews and focus groups are simply data collection tools to doing qualitative research, but they're not methods in itself. Next slide, please. Oh, sorry, I forgot to tell you to move into this slide. My apologies. Next slide, please. So quickly, what qualitative research looks like in community engagement. So in community engagement, qualitative research is always driven by community. So the community drives the research and the data, which means that the researchers have to consistently communicate and work with the community to move the research along, which means that it's participatory in nature. Some people like to use the word democratic, but I don't think it's as prevalent and well known as the term participatory. Qualitative research and community engagement also requires researchers specifically to assess their positionality and the ways in which it impacts the ways that they connect with the community. So it's reflexive in nature. So not just reflecting on your own work, but also understanding the impact that it has in the engagement that researchers are doing with the community. And the beauty, I think, of qualitative research and community engagement is that it can be creative. So sometimes they are narrative based, sometimes they're art based. So you can be as creative as you want to be in terms of your methods. Next slide, please. So the last thing I'd like to share with you guys is some of the facilitators and barriers in doing community engaged qualitative research. Facilitators to this is that research is usually bidirectional. So in terms of communication, interaction, the entire research continuum should be bidirectional, meaning the community and the researchers should be continuously interacting. It should be iterative. Specifically in the data analysis section, researchers have to utilize an iterative process of analysis where they take their data interpretations back to the community for confirmation and revisions in order to stay true to the data as possible. The partnerships are usually equitable, meaning that the community has power throughout the research process, which can look like communities determining the access to researchers in terms of their communities. Dissemination of findings in this work is usually culturally responsive, which means that a publication is not the only product that comes out of this work. You usually have to take it back to the community and share the findings in a way that makes most sense to the community. And then lastly, it usually helps build capacity for future partnerships and research. But some of the barriers that are related to this is concerns around partnership sustainability, and this is usually due to restricted funding within the life of the project. So once the project ends, even though researchers and communities may maintain a relationship, active engagement and active partnership and the work itself may be hindered due to funding restrictions. And then lastly, there could be varying degrees of readiness and training needs on both the researchers and community side. Researchers in terms of their level of expertise in community engaged work. And on the community side, their understanding of research design, research concepts, so more of the technical aspects of research. So that's pretty much a very basic, quick overview of community engaged qualitative research. Next slide, please. So with this, I think I would like to ask you guys now, what are some challenges that you have experienced doing qualitative research? And for those who haven't done qualitative research yet, what are some challenges you anticipate you might come across when doing one? So please feel free to share your responses. I'll quickly share some that are popping up in the chat. So John shares that the approach is very time consuming, adds time and complexity for research. Oh, sorry, this is more of a question. So I think maybe I'll hold on to your question, John, when we introduce our panelists and they might be able to answer your question better. Carol shares getting enough training to be able to conduct it and engage partners. That's certainly true. Dawn shares building trust with community takes time, which is very crucial. Tess shares subjectivity in coding responses. There's a level of complexity to understanding and organizing thoughts. I definitely agree. And Tess, I have some great ideas, so we can maybe connect after this workshop if you would like to engage in that conversation. All right, so folks, I think you guys are heavily and nicely engaging in the chat. Please continue to do so. But in the interest of time, I would now like to introduce our panelists for today, our expert panelists who will do a much better job at talking about community engaged qualitative research. So our first panelist is Alice Park. She is a research and policy analyst at Equitable Recovery and Reconciliation Alliance. Our second panelist is Dr. Nancy Shore. She's a professor of social work at the University of New England and also happens to be one of our longtime members of CCPH. And so now I pass it on to our panelists to introduce themselves and give us a brief overview of their work.
Thank you so much for the introduction and for having us here. I know Nancy and I both love to be able to talk about this work that we did. So I think, can you advance it to the next slide? We will be talking about project that we did with the Racial Equity Coalition, which is a self-named group of 14 youth-serving community-based organizations. They're all offering after-school programs for youth of color. And the common thread with these organizations is that the programming that they do is promoting and providing positive cultural identity for the youth from their specific culture or community. These organizations comprise Black, Indigenous, Latinx, Asian, Pacific Islander, Filipino, East African, immigrant communities, and came together recognizing that even though they all are from different communities and cultures, what they did all share was a common challenge of trying to and needing to navigate within mainstream educational institutions, and a place where their culture and their community is not celebrated or affirmed. And so these organizations realized that for the positive development for youth of color, they need a space where their culture is actually affirmed, and not feeling like that's a place that they have to hide from, but that actually is a positive asset. And so that is the common thread for these organizations. And they came together because they were tired of competing for what really were pennies when they were pursuing funding. So a lot of the funding for youth programming is going to mainstream large organizations because they are deemed to have the capacity to be able to run the programs, have impact, etc., not really acknowledging this difference of being very culturally specific versus serving everyone and serving diverse folks, but yeah, like really tuning in to the culture, being from their community, of the same community, and having that trust with these youth. And so they decided that they wanted to come together to collaborate and be able to advocate collectively for more funding for all of their organizations, and not in categories that were designed by funders, but in the ways that they know work for their youth from their specific cultural community. So the funding that they had was from the county, and was a requirement to use the county evaluator. And as they went through that process, they realized the things that were being required of them to measure were not the things that they know are the measures of success in working with their youth. They were mainstream metrics that really didn't capture like what success looks like for youth of color. So as a result, they wanted to have an external way to be able to measure and really tell the story of the impact and the work of their organizations. And so that is how we end up getting to get connected with Dr. Shore to be able to lead the qualitative research and really provide that storytelling that the coalition really desired that was not being done by the evaluator that had been hired for the project. So that's a bit of background on these organizations and the coalition and how they all came together. And then I think, do you want to move to the next slide? And I think I actually did address some of these pieces, but just wanted to say that the issue that they're really trying to address are these persistent educational racial disparities that continue to exist. And while educational outcomes have improved, and you'll see that trend, the gap between students of color compared to white students has not changed at all in decades. And so really trying to narrow that gap was their focus, and really trying to be able to provide that type of programming that they know works to support their youth and their identity and their self-determination, And not surprisingly, a lot of these programs are focused on youth leadership and advocacy and organizing, and really helping these youth to see themselves as powerful change agents. And so doing that work within these programs, not surprisingly, translates into all facets of their life, including their ability to stay within schools and to succeed in education. So I think I'll leave it at that and turn it over to Nancy.
Great, thank you. And again, thank you as well for inviting me here today. It's always exciting to be able to work with Alice. We've done several projects prior to this one. I know there was a comment that I think that came up in the chat. I didn't see the full comment, but that spoke about issues of trust and how important trust is in creating equitable partnership work. And I was fortunate that I had a long-standing relationship with Alice through our work together at Community Campus Partnerships for Health. And through that trust, she was able to invite me into the research process. The coalition had already formed, had already identified some of the pressing issues that they wanted to address. And my introduction was facilitated by Alice, since I didn't have a pre-existing relationship with members of the coalition leading into the work that we did together. Alice has done a beautiful job speaking about the background of REC, why they came together, some of the pressing issues that were being addressed. I think I'll spend a brief moment speaking a bit about our participatory research process. In terms of the research, in essence, we invited all the coalition members who were interested to join a research committee. 9 out of the 14 participating REC organizations from the coalition opted to be a part of that committee. And the committee was actively involved in the entire research process, from designing and implementing the study to analyzing the data to co-authoring study products and determining dissemination plans. And I really appreciated the point, Kunga, that you raised about dissemination needs to be driven by the community partners and not fit, for example, me as the academic partner's agenda to do multiple peer-reviewed journal articles. It really needs to come from the coalition itself, particularly as they own the data and are the ones who determines the dissemination plan. I will just add to some of the points already raised about the value of qualitative research that the group in part decided to do qualitative research in part. And again, I think this ties into some of the points Alice raised about other evaluators imposing standardized metrics that didn't fit what they were trying to accomplish. So the qualitative research approach really allowed the coalition to tell their story in their own words versus having to fit into some sort of framework that didn't reflect who they were and what their values entailed. So again, I think that we've talked about the background. The purpose of the research, again, was to identify commonalities and shared struggles experienced by REC to inform collective action. And then to understand what we came up with as a coalition was to understand what creates positive and challenging experiences with funders, and ultimately having that lead into identifying recommendations for funders to be more culturally responsive. And at the bottom of the slide, it's maybe a bit difficult to read, but that is the article, the peer-reviewed article, the one article that did get generated from the partnership's efforts, if people are interested in taking a look at the full article. But I think that I want to pause there. We're more than happy to answer questions. I know Kunga has questions for us, and I anticipate There are other questions that might come up that we'll be happy to do our best in addressing. So I will pause there.
Thank you, Nancy and Alice, for giving us a really great overview of your work. So in relation to the work that you both did, one of the first questions that I would like to ask is, how did you guys set up this structure that helped you support community partner engagement throughout your research?
And Nancy spoke to this a little bit, but I think the other thing that I would add to this is that I would say this is probably, so Nancy mentioned that we have done projects before. And so this is probably the group that had, I would say, the least experience with research. Like I would say some of them probably like had none, had never done research, had never done qualitative research. So very green. And so this really kept Nancy and I on our toes and really trying to be very flexible in the methods that we're using to incorporate that. And it's not all of them. So maybe I'm trying to think, it's either like around a fourth, maybe third at most, did have some experience. And so that creation of the research committee really helped us to make use of the talents that were within the group. And so those of the organizations that had at least some experience led this research project. And then we engaged the rest of the entire coalition using different tools. For example, Nancy mentioned that they were really involved in the entire process. So they designed the interview guides. They actually helped to conduct the interviews, which I know was a space for Nancy and I are like, is that a conflict of interest? Are they supposed to be? And it turned out it not only gave them that experience with the research, but it actually ended up being an impact and a result in the fact that this coalition is still at the beginnings of the formation. They knew they wanted to try to find a different way to work together, to partner and collaborate instead of compete with one another for funds, but still getting to know each other. So in this process of them actually doing the interviews, it helped to actually strengthen and build those relationships within the organization. So the research itself process was already having an impact for this coalition. And then using tools such as Google Docs. So normally we would use a qualitative software like Deduce, and that was our original plan. And it was just the realization that having them take on yet a new tool when they're trying to take on this whole new process of doing research was too much. But what they were familiar with was Google Docs. So we ended up taking transcripts, putting them in Google Docs, and then just reviewing that together, and people could all edit it themselves. And so that worked fine to be able to do some of the coding work. I think the other just couple things I wanted to mention was one, the volunteer aspect for the research committee. So these organizations are really focused on service delivery, serving youth. And so they're really busy. So the volunteer nature allowed, just acknowledge that limited capacity and where their focus needed to be, which is with serving the kids and the youth. But then take those that had a little more capacity, who actually had the ability to volunteer and take on more of a leadership role in the research committee was important. So that volunteer aspect. And then second, stipending their time. So acknowledging that those who participated in the research committee and taking that leadership role, acknowledge and paying for their expertise for leading that research.
Nancy, is there anything that you would like to add? I think Alice explained it beautifully.
Yeah, I agree.
Yeah, so my next question, I think some of it you both have already answered in terms of, the steps you took to ensure that the research was participatory, that the entire research committee and the coalition engaged in the entire research project together. Are there any specific examples or instances that you would like to share that might help understand our attendees better in terms of like what it actually looked like, what the participatory process looked like?
Sure, I can start with that. And actually, now that I think about it, I do want to backtrack it just for a brief moment, just to explain too that how the group was informed and how the group informed the research design and process. The research committee was pretty intensive work. We met twice a month over Zoom for 6 months just to get everything ready, you know, from figuring out what kind of data collection method we wanted to use, how we were going to use it, who was going to do it, and then to do some of the analysis that in a minute I'll talk about how we took it from the committee and brought it to the coalition as a whole. I think the other thing that I would want to also add to in terms of what Alice said is that there was, as she mentioned, a range of experiences on the committee, on the research committee in terms of doing research. So that necessitated us doing some training and support for people so that they felt like they could be full participants in the committee itself. But as Alice mentioned, there were several who were lead researchers and who had done some amazing innovative research. And fortunately, they were very open and willing to step in and take on leadership roles and facilitating conversations, making sure that the interpretation of the interview data was made sense. So we really appreciated that. And I would also add that the other key piece that had a significant impact on the design and implementation of our research was the committee's lived experiences with racial equity and their deep, deep connections that Alice has already spoken to with the communities they serve. Without that expertise, I would say within the community, we risked not asking the right questions or how to follow up on the questions that we did ask and how to make meaning of the information that we received. So I think, again, I would say that the research was driven by and benefited from the research committee's wide range of expertise. And while it was a lot of work, it was very motivating and inspiring, and the conversations were very energizing and making sure that we stayed on track. But I think, so that was my backing up, and you had asked to give some examples, is that right, of how we did it in a very participatory way? I think Alice has touched upon quite a bit of that. The only thing that I would add is that I think, Alice, you've talked about how the research committee, the work that we did that led up to what we are calling the research retreats. And that basically is, you know, we had a very iterative process within the research committee to look at the coding reports that we generated from deduce to make sure that our coding decisions made sense, that there weren't problematic, any sticky points that we needed to address. And as Alice said, they lived in Google folders, so everyone on the committee had access to read and review them. And then the committee made a decision about what the next step ought to entail. And what we came up with is that we wanted to schedule 3 research retreats. And this was the time in which this group on the research committee would present what we found to the whole coalition so that the whole coalition had the opportunities to engage with what we were coming up with. And so basically what the research committee had said is, don't give the coalition coding reports. Those aren't very digestible. It would make more sense to take the coding report. So for example, the coding report, if we had one theme or one code that looked at how rec members measured youth success or what youth success looked like them. So a coding report is basically where we took all instances across all 14 interviews where people talked about what youth success looked like. So we had from across the 14 interviews, maybe a 6-page or 7-page, I can't remember, coding report. And then what we did, we asked who wanted to be involved. And as Alice mentioned, this was during COVID. So the coalition members were exceptionally busy addressing pressing issues that they were dealing with within their communities as a result of COVID. So what happened is Alice and I primarily took those coding reports and made those into narratives. And a narrative basically is weaving together the different coded pieces or excerpts that talked about, for example, what does youth success look like? And the narrative is in essence what it looks like, what you would see maybe in a results section of a peer-reviewed article. So it tells a story. It's not separate pieces of chunked information. And this was off the recommendation from the committee so that it would make more sense to members of the coalition who weren't with us step by step through the initial process. So what we did then is probably a week prior to our first retreat, we sent everybody 2 to 4 narratives, asking them to please read them and come prepared to discuss them. And so then we had a huge Zoom call where we broke out into separate breakout rooms, and we had different members of the research committee facilitate those breakout rooms where they would talk to members of the coalition and basically ask them 3 guiding questions. You know, what needs clarification? What surprised you? What needs to be added or changed? And it was a 90-minute breakout session. So each breakout session took different narratives. And at the end, we saved 30 additional minutes for everyone to come back together to report out, to talk about what they saw, what concerns they had, what ideas popped up. And we did that 3 times. And so we then took all the feedback from what we got from those 3 retreats, then revised the narratives accordingly, put those revised narratives back into folders on the Google, in our shared Google folder, inviting people to please make sure that, you know, what the revised narrative looks like is what you intended it to look like. And so those were some of the examples of how we engaged not only the committee, but then moved from the committee to the coalition and making sure that we were telling the story in the way that the coalition wanted their story to be told. I don't know, Alice, if you had other pieces that I missed.
Yeah, Nancy, I think that's such a beautiful example of, you know, a bidirectional approach to research that is participatory as well as iterative. So thank you for sharing that example. I wanted to actually quickly address a couple of the questions from chat. One that is specifically related to Alice sharing about the stipend to the community partners. Jessica Jones asks, what amount did you identify for the stipends to community partners, and were there any difficulties in paying community partners for this work?
Nancy, do you remember the amount? I can't even remember, but okay. I know that we did come up with kind of like thinking about the estimate for the time it would take. So Nancy mentioned that we met twice a month, and kind of coming up with an hourly, which I'm pretty sure was either 75 or 100 an hour. So thinking about the meeting time, how much time it would take outside of the meeting to do some of the work. And that's how we came up with the stipend amount. And payment of the stipend, it was important to offer it either to the individual or for the organization. So depending on if the person was able to squeeze in this work within their work time, but if not, if they were too busy kind of doing their work and had to do this really outside of those work hours, they had that option to receive it to themselves as well. So that was really important.
So, and to the second part of the question, were there any difficulties in paying community partners for this work in terms of funding or any other related challenges, perhaps?
There weren't any difficulties. This was more unrestricted in nature because it was philanthropic, as foundation, more foundation type dollars. So that allowed the payment for stipends, thankfully.
Thank you. Another quick chat question, I think partly in relation to this compensation question. Jennifer asked, has anyone engaged FQHC's federally qualified health center physicians in supporting research? And if so, how were they compensated for their time? Alice or Nancy, did any one of you want to answer that question?
I don't think we engaged anybody that fits that category, but so my mind is trying to recall, and I don't believe that that happened within this project.
Thank you for sharing. So going back, I think, picking back up on the participatory nature of the of your work, can you share with us some of the great benefits? I think you've shared some of it already, but can you share with us some benefits using this approach to your work?
And I can take that one on. And I think I've sort of touched on these, but just to highlight again, I had mentioned the relationship building. So really kind of listening to the organizations and the way that they wanted to conduct the research and saying like, no, we want to be the ones to be able to interview our colleagues. And that really, that added benefit of that kind of deep relationship building that happened from that. I wouldn't have happened actually without their input if it was just Nancy and I. So that was really important to really listen to them. I think that meeting them where they are, allowing them to engage in the way that they could. So just knowing that they were really busy. I mean, thinking back, I marvel that they had the ability at all, given everything that was going on. But this really allowed everyone to engage in the capacity and the way that they could. And then I think the other benefit of flexing was being able to use tools that were familiar to the group. So using the Google Docs was really new to me doing qualitative research, but it was a tool that was much more accessible for community and familiar to them. And so it worked really well to be able to make that flex and make the research more accessible.
Yeah, that's a great example of meeting where the community is at. Thank you for sharing that. So in the interest of time, I think I'll ask the last question, which I think was also asked by a lot of our attendees in the chat. So can you please share with us some of the key findings and recommendations that came out of this work? And I think if we can pop the slideshow back in, that would be great. Cherise, thank you.
Yeah, and so I'll go ahead and touch on this one. And so hopefully you all have seen the beautiful report that the coalition developed. And one other thing I did want to mention in terms of like kind of harvesting and using the talents within the group. So we really used the folks that had the experience with research, but we also used them to actually do the graphic design. And so it turned out one of the younger folks in the group had graphic design experience. And so the report really reflects the group by actually using their expertise to have the design of it look the way they wanted. And we knew, like, having a published paper, I mean, they were really they knew that the storytelling and the report that they generated is what is telling their story in their words. And they also acknowledged that more of the peer-reviewed published papers is what the funders are really looking at as evidence. And so again, knowing that they were very pressed for time, like we could have written easily 10 papers, I think, out of the content that is in their report. But knowing that they really didn't have the time to do that, but wanted to have something identified challenges with funders as being the place that they really wanted to focus for a paper. So we narrowed it down to that, but that really just ended up being identified as the biggest challenge facing these organizations as they're trying to do their work, with funders kind of coming up with their own categories of what they're willing to fund, the type of programming, and not really allowing the organizations themselves to be able to serve the youth in the way that they know works for their youth. And the kind of harm that dynamic created ran really deep. So to the point where it creates rifts within those communities, as the leadership of these organizations are just searching for funds to be able to keep their staffing and to be able to operate these programs, but then staff then having to operate these programs that have been dictated by funders that really don't work. And so creating a rift between the leadership and the staff within the organizations, and also then distancing the youth from the organization, so that the harm that creates, that practice creates, really ran very deep. And I think the other recommendations they had for funders is really to try to incentivize this type of collaboration. So I saw one of the comments about how the funding for these partnerships and the relationship building, which is kind of the key thing, and very similar for these organizations. There is funding for their programs, but there isn't that funding to do this trust building and working together, where they're strengthening each other's organizations. And then maybe just the other thing I'll mention is maybe a couple things. So just unrestricted funding to be able to allow the organizations to serve the youth in the way that they know works. Multi-year funding. These organizations are really working on systems change because the systems are not set up to allow students of color to achieve. That kind of change can't happen in 1 or 2 years. They need 5, really 10 years to do that. So multi-year funding. And then also having some funding to be able to build the capacity of smaller communities of color-led organizations. A lot of the ones that we worked with have just the one staff person and that's it. But to allow them to grow their infrastructure so they have more capacity to be able to engage in such as this research project, if they could have another staff person to help out.
Thank you, Alice, for sharing that. I think we are at time, unfortunately. And so, Charisse, I will pass it on to you. And thank you so much, Nancy and Alice, for such a wonderful conversation. Yeah. Charisse, off to you.
Yeah, thank you all so much. Okay, so we're just going to close this session real quick. We're always striving to create, shared educational experiences like this. So if you're interested in how we do the work, feel free to explore our training offerings. If you have any questions, feel free to reach out at feedback@ccphealth.org. And like I said, we strive really hard to make these shared learning experiences inclusive and interactive, and we value your input and ideas on how to improve that. So please take the next 2 minutes to complete this very short survey. We don't have much time to work on it right now together, but I think the survey's in the chat. Thank you, Emily. Check out our website, ccphealth.org, and find us on social media. And the last thing is, this is our last Lunch and Learn workshop in the series, but it's not the last thing that we're doing. So first of all, thank you so much for attending our Lunch and Learn series, even if it's just for this one workshop, Qualitative Research, or you've been with us since the beginning with participatory budgeting. I think Emily is going to put like all our previous Lunch and Learns in the chat. That includes all the English and Spanish interpretation videos, or the recordings, as well as the one-pagers, slide decks for every workshop as well. And the second thing is, thank you all for being here. Stay in touch. It's not the last thing that we're doing. And we have a few more exciting things to offer this year and next. So subscribe to our newsletter, follow us on social media. And that's pretty much it. Thank you all very much for your time, and we hope you have a wonderful day. Thank you to the ASL and the Spanish interpreters. Thank you to Nancy and Alice and for Kunga for moderating this. And thank you all.